So good afternoon, Dr. Vitaleski. Thank you for taking the time to meet with me. I appreciate you, and I wanted to go over the recent case we've been having with our mutual patient. So she's been seeing me for about 3 weeks now, and she originally came in for neck pain and low back pain, and I understand that she has been discussing those issues with you as well. She's been on a prescription of the 25 milligrams of tramadol, and she was up to 6 of those 25 milligram tablets a day. And after the 3 weeks of being treated with me, she's now reporting a decrease of the daily pain she's been experiencing. And I know that you and I talked about working on a plan to kind of get her down on less of a dosage. So I think it's positive we could get her down from 6 tablets to 4 tablets a day, which I know is what your goal was for her, and I think we have a very realistic chance of doing that. The one issue I'm coming into contact with our patient is that she doesn't seem to have the desire to decrease her dosage. She expressed to me that she is 65 and she feels that given her life experience and who she is, that if she chooses to take the same level of prescription, that she shouldn't have to stop if she doesn't want to. So we might be running into an issue of mind over matter, where she doesn't think she can do it, or she may be afraid to try. But I think based on what you and I have discussed, that we should try to get her to get to that four tablet a day limit. We've been doing some really great adjustments on her, like we talked in our last meeting, the Thompson adjustments with the drop table, getting her cervical vertebrae back in place as well as her lumbars has really helped her issues with her sacrum and with her pelvis. So she's reported less pain every time she's come in, where she was coming in at an 8 or 9 out of 10 on the pain scale. She's now coming in with anywhere from a 2 to 4. So it's been really great, and that's something that you and I talked about, was her decrease in pain, which is a positive note. So if we can keep working toward possibly reducing the amount of tablets to where you feel you're comfortable with what she's taking, and then I'll hopefully the adjustments she's receiving will help to supplement some of the pain that she's coming in contact with. So thanks for meeting with me. So that was a little bit of scripting I had with a real medical doctor that was treating one of my patients. We actually worked together, and she was interested in what she was interested in what the patient was receiving in the clinic, and so I kind of met with her, talked to her about it, and she had this working case co-management with the patient, and talked about reducing the prescription that she was on, because that was a goal she wanted to get to. So it was really cool to do that. We both were very respectful to one another. She was supportive of chiropractic. I'm supportive of the medical industry. So it was cool to work together with the two of us and see that kind of relationship be able to blossom, especially as a student, and her being a support of Life University and what we do. So in working with any healthcare provider in another field, it's just important that to keep humility, and to make sure you're not trying to overstep the knowledge that you have. Make sure you're approaching them as an equal playing field. You're not trying to disprove them or make them wrong. You're trying to show that their knowledge and their advice is just as important, but that we can work together in a nice mutual relationship. So that's how it would work. Thank you.